Hello, it's Lisa Philp, Chief Visionary Office of Transitions Group. It is with great honor and pleasure that I welcome a special friend and colleague of many decades who's made a significant impact in years of dentistry in not only case acceptance, but also helping dental practices to be better tomorrow than they were yesterday. Dr. Paul Homley and I are going to share some tips with you on a topic that's come back through all of our virtual work during COVID, now that we're getting into post-COVID, on the most common thing that dentists answer of what would make their day better in dentistry, what would make them feel more fulfilled, more productive, and have the practice of their dreams, regardless of any challenges that have come over the last year. And a very, very relevant and most common answer for all of our audiences in Canada and the United States is dentists really want to do more of the dentistry that they love to do. Yeah. So our tips, Dr. Paul Homley and I are going to work on what are some key elements that you can focus strategically to do the dentistry that you love to do, that you're technically gifted in doing, and that you deserve to be able to do.
Yeah, Lisa, talking to my clients here in the States, when I have these conversations, I say, well, okay, are you as busy now as you were before COVID? And most of them say, yeah, we're just as busy. How about on your end, Lisa?
Yeah, I think it's getting there. Our country's been a little bit slower in the opening back up, but I am extremely proud of dentistry and how resilient they've been and how they truly have proven they're pandemic proof. I also am finding something else, though, is there's a difference between being busy, which exhausts us, and being productive, which fulfills us. Right. So we feel like we're adding. So I think now that the chaos is done of all the changes in the adaptation of dentistry as a safe health part of healthcare. It's interesting though, Paul. There's a belief and a myth that dentists believe to make more money they need to work harder. And
I believe that. I believe that for about the first 5 years of my practice, Lisa. I mean, it makes sense. Hey, more patients, more dollars. And that's an addiction because you get sucked into this busyness mentality. And in the beginning, maybe that's not so bad, Lisa, for the young dentist getting his or her feet on the ground, getting the hand speed up, working with dental assistants, getting to the point of being competent and confident around patients. I don't think being too busy is bad at all. However, it gets old. It gets old real fast. And after a while, one patient is too many and 100 aren't enough. I mean, it's just, and getting back to that statement that you made about our dentists, are they busy, but are they productive? And I would add to that, are they fulfilled? The surveys that I did and the survey that you quoted, Lisa, I asked dentists, what would make your practice better? What would make you feel more fulfilled? And it was multiple choice. Would it be greater income? Would it be fewer staff issues? Would it be doing more of the dentistry you enjoy? Would it be working less? Would it be doing, the types of procedures that challenge you? And most of the time, the clear majority of dentists they wanted to do more of the dentistry they enjoyed. And when that domino tips, a lot of other things tip with it. Getting along with your staff, being more productive, being more profitable, all of those things fall into place. And that's one of the reasons, Lisa, that I love working with transitions with your group, because you guys have always been about the quality of life of the dentist and the team. You've always been. I remember the conversations we had 20 some years ago. You were showing me all your stuff. I'm going, man, you're so far first on this stuff. Nobody is second. And so when you and I started talking about doing some things together, I jumped at the opportunity because we're both on the same page. We take slightly different paths to get to where we want to go, but we get to the same place of helping dentists and teams do more of the dentistry they love. When they do that, they make more money, they'll live longer, and they have a happier home life too.
Yes, very important. So, Paul, do you want to start with maybe what you believe at the top of your list is a contributor? And, we know that practices need to have systems, they need to have healthy team culture, they need to have
Right.
patient flow, and you put the people first, the money comes. But maybe start with sharing with what you believe is your one of your top choices of how do we get dentists to do more of the dentistry they love to do?
Well, Lisa, you asked me what would be tops. What's tops on my list for dentists to do more of the dentistry they love? And what's tops on the list is that they need to understand. They need to understand their patients better. It's that simple. We've been. I think dentists have been brainwashed into believing that patient education is the cure-all to having patients accept their complete care. And I'm going to take issue with that. And I don't think it's so much about educating patients. I think it's more about understanding patients. When you understand your patients, that's when patients will have more confidence in you. So a way to go about this is to look at your patient base basically in two groups. Those cases that their complete care fees are less than $3,500, 3 or fewer restorative units. This is modest care dentistry, maybe a crown or two, a simple filling, a cleaning, that kind of thing. That's their complete care needs. And understand, complete care does not mean complex care. Complete care can be something very simple. Think about those patients whose total care needs are relatively modest. Also, another group of patients is that their complete care needs are significant. They're complex. They're greater than $3,500. It's greater than 3 or 4 restorative units. These two divisions between patients is going to be extremely important going forward in understanding how to do more of the dentistry you love. If you look at the horizontal scale here, all the way to the left is tooth dentistry. This is the modest care patient. All the way to the right is complex care dentistry. And there's a vertical dividing line going up the middle. That's kind of the dividing line between modest and complex care. And those patients whose complete care fees are relatively modest are to the left of that dividing line. So we're going to refer to them as left side patients. This is just nomenclature, Lisa. This is just a way for us to talk about things in kind of a shorthand method. So we're going to refer to those modest care patients as left side patients. Those patients who need more complex care, we'll refer to them as right side patients. Now, why is this important? Left side patients and right side patients have distinctly different preferences during the new patient procedure. And when I talk to dentists, when I ask them, Lisa, I said, what kind of dentistry you love to do? What would really make you happy on a day-to-day basis? And I hear, oh man, Homily, I'd like to do more veneers. I want to do more aligner orthodontics. I want to do more dental implants. And what I'm hearing is they want to treat more right side patients. And so what we're going to do is we're going to look at the behavioral preferences between left and right side patients. Now, let's start with the left side patient. Typically, they're young. Typically, they're under 40. Typically, these people have minor conditions. They don't have a lot of things going on in their mouth. These folks have minor disability. Now, if the viewers at home are taking notes right now, Lisa, this would be a good time for them to maybe write down some notes. A disability, this is a part of the nomenclature going forward.
Yeah.
A disability is the patient's emotional component of her condition. For example, Helen's got a chipped front tooth. Helen works at the bank. The chipped front tooth just happened the other day. She goes into the bank. She's talking to her customers. She's talking to her coworkers. And after a while, she notices people staring at her teeth. Well, she begins to get embarrassed. She begins to hide her smile. And so after a while, she gets really weird about the whole thing and she won't talk to anybody. The condition is the chipped front tooth. The disability is her embarrassment. The disability, Lisa, is never in the mouth. The disability is in their lifestyle. So what I'm saying here is that left side patients have minor disability. Left side patients have minor fit issues. Here's another issue to write down, a fit issue. That is a life circumstance that enables patients to be ready for care. Fit issues would be health issues, budget, work issues, family issues, travel, all those life circumstances that patients need to fit your dentistry into. And what I'm saying here is typically left side patients have minor fit issues. Why? The fee is relatively modest and the duration of treatment is fairly modest. So it's more easily fit into a patient's life. A very important aspect between left and right side patients here is the role of patient education. And the role of patient education with left side patients is key in getting them to accept complete care. Why? Because oftentimes left side patients, Lisa, are not aware of their conditions, right? How many times have you heard dentists say, well, I asked my patient, why are they here? They say, well, it's been a while since I've been to the dentist and I haven't had a cleaning for a while and I really don't have any problems, this and that. And the dentist goes in, does an exam. There's class 2 decay everywhere, periodontal disease, missing teeth, malocclusion. Patient's got a mouthful of problems. Patient is unaware. Patient doesn't have any disability related to their condition. So what do? Well, we show them the photographs, we show them the x-rays, and we educate the patients to their condition. And it's through the process of education that patients become concerned about those conditions. And then concern becomes their disability. So we educate left side patients into concern, which is their disability. And finally,
something, Paul,
sure.
Just interject. Something you've taught me for years is a patient says yes when they're talking, not when we're talking. And oftentimes practices get caught up in what I call the show up and throw up model, where they right? The show up and throw up, where they lay they're flat on their back and they just start talking in their wonderful high intellect, left brain jargon and terms that no one can understand.
Right. Absolutely. Yeah.
We're going to ask before we tell.
Yeah, that's a good point. Patients say yes when they're talking, not when you're talking. Yeah, but there needs to be a certain amount of patient education to fulfill consent issues and to fulfill issues of prevention. So, and I believe that it's been my experience that patient education for those left side patients, we really need to let people know, here's what's wrong, and and you need to fix it, and here's how we're going to do it. And typically, left side patients are typically more ready for care. When I say ready for care, Lisa, what I'm talking about is, within a month or two, they're going to get something done. They may do all of it, they may do some of it. And the reason that they're ready is very simple. It's because it fits. It fits. In most dentists, my experience here in the States and with Canadian dentists, most dentists are fairly successful with left side patients and the patient education model for motivating or inspiring them to accept care. Okay, so now let's talk about the right side patient. You see, it's the right side patient, Lisa, that dentists tell me these are the patients they want to do more of the dentistry that right side patients need. The veneers, the crowns, the implants, the aligner therapy, the reconstructive therapy, the all-on-4, the all-on-6, the all-on-everything kind of treatment plans for these patients. And it's understanding these patients. These patients have significant differences in how they perceive the healthcare environment and the healthcare providers. First of all, they're mature. What does this mean? That means that they've got more experience in the healthcare environment. These people are typically over 50. What does that mean? It means they've been to the cardiologist, they've been to the urologist, they've been in the healthcare system long enough to know that they don't have the illusion that they're going to live forever. And so they have a higher appreciation of quality healthcare. They're more dialed into how they feel about their relationship with their provider. These patients, Lisa, look for signals that they'll be well cared for. They've been to many different dentists in their lifetime. They've been to many different medical providers. So they've got a history of healthcare experiences and practices that want to treat more of these patients. When they can demonstrate to these patients that they understand their particular needs, boy, that's the magic right there. And recently I've had some health issues of my own, some shortness of breath. I've had atrial fibrillation, all of these normal but unacceptable health issues that I've run into over the years. Understand, I'm 71 years old. I've been over some tough road, and I understand what it takes, not only as a provider, but I also understand what it means as a patient to get the feeling that you'll be well cared for. More mature patients are wiser, and it's that wisdom that they'll evaluate their providers with. So it's really key here, Lisa, that if a practitioner wants to do more of the dentistry that's more complex, that they really get these distinctions that I'm going to make right now. Let's start with the major conditions. This is not simple class 2 decay. This is partial total edentulosum, severe sleep issues, malocclusions. The conditions are significant. These conditions also result in major disability. And here we're not talking about simple embarrassment. We're talking about major health issues, digestive problems, breathing problems, speech problems, all of the things that come along with oral disease, intimacy issues. There's significant lifestyle hindering situations that patients experience, major disability. Also, these folks have major fit issues. It isn't a $1,200 fee anymore. It's a $30,000 fee. It isn't, 3 appointments and they're done. It could be a year or more in treatment. So it's a much greater complexity of the healthcare relationship they're looking at. These folks, they don't need the brush and floss lecture anymore, Lisa. No. That train has left the station. They have heard that till they're blue in the face. What these patients need is less education and more understanding. Now, don't get me wrong. I'm not saying that we shouldn't educate our patients. What I'm saying is just cut back to a pack a day on this stuff, especially with this right side patient. What these folks need is the experience of being understood. That is, what is it that you need to understand about these people? Here it is. It's sitting right in front of you right now. Number one, you need to understand what is the lifestyle limiting aspect of their condition. How does this condition get in their way? Get curious about that. Don't rush over that. Be curious about how this condition influences the patient's life. Is this a problem that's more a problem at home or at work? And how does it get in the way? And by understanding that, then what happens is the patient will realize that they're in an unusual healthcare environment where a provider is actually interested in listening to them. They don't get that experience, Lisa, in the medical community, where oftentimes these right side patients or these mature patients spend hours in waiting rooms, waiting on doctors who oftentimes have an attitude that they're doing the patient a favor. Now, I might be overstepping my boundary here a little bit, but I've been in enough hospital situations with myself and with my family members to know that the medical community is not real high on understanding patients. They're more focused on conditions and treatment. And I think you can only go so far with conditions and treatment in the dental community. In the dental environment, there needs to be empathy. There needs to be empathy and understanding of how this condition gets in the way of patients. And for me, Lisa, a perfect example of this I've had a recent bout of shortness of breath. It's related to a couple of things here. I live in Arizona now. It's 150 degrees outside and air quality sucks. And I picked up this a little bit of shortness of breath. Now, shortness of breath is okay. Nobody can get really excited about that as a symptom. But to me, as a speaker, that's a major disability. I'm sitting over here sucking on water right now, trying not to cough in this microphone. It's a major disability. And if a provider would say to me, hey, Homily, I understand that you're a speaker and this is important for you, and let's see if we can get you in front of audiences sooner than later. That's all I would need to hear to make me feel understood.
You know, Paul, you use a key word, especially in the country of Canada, as the Canadian Dental Association did an amazing survey to patients, to consumers, of what's their level of satisfaction with dentistry, and what's their perception of a good dentist, and what's their expectation of their experience. Alarmingly, sorry, not alarmingly, but like at the top of the list on both of those answers, their perception of a good dentist is someone who shows empathy, which takes time to understand the patient before they start telling them all the things they need. And also their expectation of their experience is empathy. So it's fascinating. And whether it's, I don't think it's a Canadian or an American thing, but it was a big wake up call for the practices that were doing 80% of the talking, 20% of the listening, and then sending them to a 3 to 5 minute checkout saying, how do you want to pay? Sorry, your insurance doesn't cover this. Right. So I think it's a lot about the human capital business of the communication, and they want to be heard. 68% of patients say they would change a dental practice because of indifference. And indifference is truly the feeling that I don't feel like anyone cares.
You know, in caring, how do you manifest caring? How do you really manifest that? You know, we've danced around that word caring for 30 years, Lisa, you and I. Yeah. And so how do you manifest caring? You see, caring is an emotional outcome for the patient. For us, it's, okay, what procedures or what process do we use to manifest the emotional outcome of caring? Here it is. Caring is all about empathy. Yeah. Caring is about taking the time to understand how a condition interferes in the patient's life. And it isn't that you need to cure that disability during that conversation. The first step to curing is understanding. We never learned that in dental school. Yeah. We learned the condition. Here's the condition. Here's how it happened. And here's how we're going to fix it. And here's 3 different ways you can pay for it. You can get away with that, Lisa. Yeah. With left side patients. And there's the issue. Dentists try to use the case presentation process, the new patient process and a case presentation process that's worked for them on left side patients. Oftentimes, dentists believe, well, we can do this on right side patients too. No, you can't. No. You can't, because these patients are looking for something different. Left side patients, they don't have a worry in the world. They got a car payment and a cat. You know, that's not a lot on their mind. You know, right side patients, they got a whole life experience. And as patients age, patients' life circumstances get more complex as one ages. Things don't get simpler for patients as they age. It gets more complicated. And when a right side patient meets a healthcare provider who can understand them and be curious about their condition, is they're not going to leave that provider. Ultimately, Lisa, the right side patient is rarely ready for complete care. When I say not ready, I mean, I'm not ready today for complete care. Why? Because it doesn't fit. They may have existing expenses in front of them, or health issues, or time issues, or family issues. And oftentimes, these people will need to take several months or maybe even a year or more to get ready for care. And the trick here is to present care so well to these patients that even though they're not ready, they'll never forget how well you offered it. Yeah. And when they become ready, they'll return to you for care. So the distinction, Lisa, your question was, what's tops on my list
Yeah.
as far as helping dentists do more of the dentistry they love, simply is to be aware, to be conscious that treatment acceptance for left side patients is through the process of patient education. It's very simple. And most dentists are successful at that. The problem becomes when we use that education-based model for right side patients can't connect with the provider, the provider that simply educates them and doesn't take the time or the skill to understand them.